This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about the difference between surgical complications and medical malpractice. If you like this video, we put out new content weekly, so please like and subscribe. So, surgical complications, medical malpractice. Sometimes if it's like a Venn diagram, there's a little bit of overlap, but they're very different. So, surgical complications are when something goes wrong during the surgery or after the surgery. Like, for instance, since I'm in the world of orthopedics, let's say you had a knee replacement and it gets infected. That's the surgical complication. Let's say you had a fracture and it gets fixed and all the screws and plates are in place, and then all of a sudden it falls apart and the screws pull out and the plate breaks. That's a surgical complication or a complication. Or a complication, let's say you have a fracture and it gets fixed but it doesn't heal. Like, that's a complication. None of those are malpractice. Malpractice happens when the doctor violates the standard of care, meaning they did something that doctors don't normally do, and because they did that, you ended up with a problem or pain and damages. For instance, if they're doing a knee replacement and it gets infected, that's not malpractice. If they're doing a knee replacement and there's a break in sterility, meaning let's say the doctor's arm is exposed and they don't know it and it gets infected, that would be malpractice because doctors don't normally do that. If someone's going to fix a fracture and they put the plate and the screws on and the screws break, that's not malpractice. But if they were going to fix the fracture and they put the plate, let's say, on the wrong bone, or they didn't go like they only put one screw in or something like that, then you're sort of looking at more malpractice. So again, it's got to be violation of the standard of care. So sometimes people could have surgeries with unfortunate outcomes, but again, it's not malpractice because they didn't violate the standard of care, even if another doc would have done something slightly differently. So, for instance, I saw one time where a guy had back surgery and he had a microdiscectomy and he still had back pain, and then he goes to another surgeon. The surgeon says, "I would have fused it." A different surgeon. That's not malpractice because both of those treatments are within the standards of care. So malpractice is a pretty high bar to jump over. The easiest cases I've seen for malpractice are essentially breaking sterility with people not, having sterile setups, using unsterile instrumentation, not looking at wounds, that sort of thing. So it's along those lines. Sometimes misdiagnosis. So I hope I was able to answer your questions about the difference between surgical complications and medical malpractice. If you like this video, again, we put out new content weekly, so please like and subscribe. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any specific details about your situation because this video and all my videos are for educational purposes only. Thanks for watching.